Hello everyone, I welcome you back to this channel and to this 7th episode of Target Nursing Officer Exams. And before I start, here is the beautiful quotes written. The best preparation for tomorrow is doing your best today. It is a reminder for us to be motivated to work towards our goal. Question number 1. Master Bikas has renal calculus and he is of 35 years age. He is believed to have a small stone that will pass spontaneously. To increase the chance of renal stone passing, the nurse would instruct the client to take a lot of fluids and to option given. Option A, ambulate. Option B, remain on bed rest. Option C, strain all urines. Option D, ask for medication to relax him. So in this question we see it is a case given that Mr. Bikas of 35 years age has a renal calculus and the stone are small that can pass spontaneously. So to increase the chance of stone passing while urination, so the nurse would instruct the client to take lots of fluids and to the correct option here is option A, ambulate. Ambulate will help the stone to pass, by mobilizing the stone. Question number 2. The client has rectal bleeding with 16 diarrheal stool a day, severe abdominal pain, dehydration, tenesmus. Due to this symptom, the nurse should be alert for the other problems associated with what this is. So here in this question number 2, the case is given that the patient has rectal bleeding and has diarrhea 60 times, loose motion, and the client has abdominal pain, dehydration, tenesmus also. What is the meaning of tenesmus? Tenesmus means when a patient or when a person feels like he needs to pass stool even though his bowels are already empty. That is tenesmus, and due to these symptoms the nurse should alert for the other problems associated with what disease. So the question asks what type of disease has these symptoms. The option given, option A, diverticulitis, option B, Crohn's disease, option C, ulcerative colitis, option D, peritonitis. The correct option here is option C, which is ulcerative colitis. In ulcerative colitis, the ulceration leads to sloughing that leads to passing of loose stool for around up to 20 times per day, associated with blood, mucus and pus also. Question number 3. World AIDS Day is celebrated on which day? Option given, 12 May. Option B, 1st December. Option C, 4th July. Option D, 1st April. The correct option here is option B, which is 1st December. 1st December is celebrated as World AIDS Day. Question number 4. Which usually rare cancer is associated with HIV? Option A, astrocytoma. Option B, mesothelioma. Option C, penile cancer. Option D, Kaposi sarcoma. The correct option here is option D, which is Kaposi sarcoma. Kaposi sarcoma occurs in patients with immunocompromised, like in case of HIV/AIDS, or in patients who undergoing immunosuppression, like in case of organ transplant patient. Transplantation, and this Kaposi sarcoma was first described by Moritz Kaposi in 1872, and the causative agent is human herpes virus or Kaposi sarcoma, herpes virus, or also called HHV8 virus. This is the causative agent of Kaposi sarcoma. And what is this astrocytoma? It originates from the word astrocyte. Astrocytes, which are the cells present in the cerebrum. They are the glial cells present in cerebrum, and this astrocytoma is the most common glioma affecting the brain and spinal cord. And what is this mesothelioma? It is the cancer of mesothelial cells associated with asbestos exposure. When the person get exposed to asbestos, it can lead to this mesothelioma. Question number 5. After taking an HIV antibody test, the patient is required to wait option A 30 days, option B 1 hour, option C 30 minutes, option D 10 minutes. The correct option here is option C, which is 30 minutes. After taking the HIV antibody test, the patient required to wait for around 30 minutes to get the result. Question number 6. Systemic lupus erythematosus is option A, infectious, option B, harmless, option C, always associated with HIV, option D, an autoimmune disease. Here the question is asked, what type of disease is this? Systemic lupus erythematosus, also we call SLE, it's a type of chronic autoimmune disease. So the correct option here is option D. Question number 7. In patients with systemic lupus erythematosus, the immune system is option A, underactive, option B, overactive, option C, inactive, option D, none of the above. The correct option is option B, which is overactive. In case of SLE, the immune system is overactive. Question number 8. The butterfly rash, often seen in some people with SLE, is found on option A, the back, option B, the legs, option C, the face, option D, the neck. Correct option here is option C, which is the face. The butterfly rash often appears on the face of the patient. Question number 9. Systemic lupus erythematosus is seen more in option A, men, option B, children and women, option C, men and children, option D, women. The correct option here is option D, which is women. SLE is more common. SLE is more common in women. Question number 10. Irritable bowel syndrome is most common in option A, older white males, option B, children, option C, young white women, option D, women. The correct option here also is women. Irritable bowel syndrome or IBS is more common in women. Question number 11. People with irritable bowel syndrome for longer than 10 years, option A, will need a hemicolectomy, option B, will get cancer, option C, will be unable to have children, option D, none of the above. So the correct option here is none of the above. The people with irritable bowel syndrome will not need hemicolectomy or will not get cancer, or they are still able to have children. Question number 12. People with irritable bowel syndrome often suffers with option A, diarrhea, option B, urinary tract infections, option C, diarrhea and constipation, option D, constipation. Correct option here is option C, which is diarrhea and constipation. People with IBS often have sometimes diarrhea and sometimes constipation. So this happens like sometimes they will get constipation and sometimes they will have diarrhea. Question number 13. In irritable bowel syndrome, antibiotics are option A, the drug of choice for treatment, option B, use pain relief. Option C, ineffective. Option D, only prescribed in those over 18 years. The correct option here is option C, which is ineffective. In IBS, antibiotics will not be effective since this is not caused by a microorganism.